Medicare's new $50 program covers appetite-lowering medicines that act through gut hormones called GLP-1. These include Wegovy, which contains Semaglutide, and Zepbound, which contains Tirzepatide. Medicare enrollment alone does not qualify you. You need Medicare drug coverage called Part D, one qualifying weight-based route, and a weight management prescription. Having type 2 diabetes or moderate to severe sleep apnea blocks this $50 route. The nationwide program is Medicare's Bridge for GLP-1. It runs from July 1st, 2026 through December 31st, 2027. Medicare handles approval and payment outside your Part D drug plan. A central Medicare system handles pharmacy billing, so drug plans need not join separately. That separate payment path creates a $50 monthly copay at the pharmacy. Your Part D deductible does not apply to the Bridge prescription. The payment does not count toward your yearly out-of-pocket drug limit. Medicare's Extra Help program does not reduce the $50 amount. As noted earlier, Part D coverage comes before product details. You need Part D prescription coverage. This can be a standalone drug plan or a Medicare Advantage plan that includes drugs. Some special Medicare plans, employer or union drug plans, and temporary coverage for newly eligible low-income patients can qualify. Several Medicare arrangements do not qualify by themselves. These include certain private and older plan types. PACE combines medical and long-term care, but does not qualify by itself. A Medicare card is not enough. The prescription must be linked to eligible Part D coverage. The $50 price applies only to specific products and forms. Foundayo contains orforglipron and is a covered tablet. Wegovy can be an injection or tablet. Zepbound is covered only as a multi-dose quick pen. Single-dose pens and vials are excluded, even with the same medicine. Adults 18 or older then follow 3 routes based on body mass index. It is calculated from height and weight. A body mass index of 35 or higher can qualify without another listed condition. Medicare uses the number documented when treatment began, not only today's number. The second route requires a body mass index of at least 30 and one listed health problem. The options include heart failure, where the heart still squeezes normally, hard to control blood pressure, or stage 3A kidney disease or worse. Stage 3A means kidney function is moderately reduced. Ordinary treated high blood pressure does not automatically qualify. For high blood pressure, Medicare uses a narrow definition. The top number must stay above 140 or the bottom above 90, despite 2 blood pressure medicines. One high office reading is not enough. Your records must show that poor control continues despite treatment. Beyond those first 2 routes, the final route requires a body mass index of at least 27. You also need one listed condition, such as prediabetes, a previous heart attack, or stroke. Prediabetes means blood sugar above normal but below diabetes. Poor leg circulation from blocked arteries can also qualify when it causes symptoms, such as leg pain while walking. Those weight-based rules can create a surprising exclusion. Type 2, diabetes or moderate to severe sleep apnea, makes you ineligible for the Bridge. The Bridge also excludes fatty liver disease with inflammation and moderate to advanced scarring without cirrhosis. Cirrhosis means severe permanent liver scarring. The reason is administrative, not medical. Those diagnoses may already support regular Part D coverage for GLP-1. The Bridge covers weight management that regular Part D does not. Medicare directs those patients to their existing drug benefit instead of the separate $50 program. 2 people with similar weights can therefore receive different answers. One has obesity without a separately covered diagnosis and may enter the Bridge. Another has obesity plus type 2 diabetes and is excluded. That person may still receive treatment through regular Part D pricing and rules. Previous insurance payment can also change the route. You must stay with your plan if it already paid for treatment with GLP-1. Changing brands does not create Bridge eligibility. That payment history remains part of Medicare's decision. You cannot choose the bridge simply because its copay is lower. Medicare uses the diagnosis, prescription purpose, product form, and payment history to choose between the bridge and regular Part D. Asking the pharmacy to bill the prescription differently does not erase those records. Your current weight can create a different documentation problem. Suppose your body mass index was 37 when treatment began, and it later fell to 33. You may still qualify because Medicare uses the starting number. Your clinician must record the earlier qualifying number in the approval request. 4 items decide the result. These are eligible Part D coverage, the correct body mass index route, the prescription's purpose, and supporting records. Missing one item can stop approval. Meeting the body mass index requirement without Part D is not enough. Part D alone is insufficient if your number and health conditions do not match one of Medicare's 3 routes. The prescription must be for reducing excess body weight and maintaining that reduction. Your clinician must also confirm ongoing nutrition and physical activity changes. This does not mean lifestyle changes can replace the medicine. It is a required part of the bridge request. Also, check the product and treatment reason before paperwork begins. A single-dose Zepbound pen is excluded from the bridge. Wegovy prescribed to reduce heart attack and stroke risk must go through regular Part D. Zepbound prescribed for moderate to severe sleep apnea must also go through regular Part D. Before the appointment, collect the required records. Bring your Medicare drug card, your medication list, and proof of your weight when treatment started. Also bring records of prediabetes, heart attack, stroke, kidney disease, heart failure, or hard-to-control high blood pressure when relevant. Ask the office to verify the payment route before expecting the $50 price. Ask whether the prescription falls under regular Part D or the bridge. GLP-1 coverage depends on that answer. It also affects approval, copay, paperwork, and which product the pharmacy can dispense. Prior authorization means Medicare must approve the request before paying. Your clinician must confirm the qualifying body mass index, diagnosis, treatment purpose, and product. The form should match your medical record. Vague or conflicting details can delay approval or produce a denial. Once the bridge route is confirmed, your clinician and pharmacy must process the prescription through it, instead of regular Part D. Your clinician sends the prescription, and the pharmacy may request your Medicare ID number. The pharmacy checks program eligibility. Your clinician then submits the Medicare approval form with supporting facts. Once approval arrives, Medicare sends a coverage letter. You can then pick up a 1-month supply and pay $50. Refills do not need new approval while you stay on the same drug, even when the dose changes. GLP-1 drugs require new approval when you switch products. Even an approved $50 prescription needs a long-term coverage plan because the bridge ends after December 31, 2027. Plan backup coverage before then. Stopping after substantial weight loss can allow appetite and weight to return. The $50 price is real, but Medicare enrollment alone is not the ticket. Eligible Part D coverage, the correct weight-based category, the treatment reason, and matching records decide the result. Confirm the exact drug form before submission, especially when Zepbound is prescribed. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.